Dear friends, good evening to all. I am Dr. Arun, consultant gastroenterologist and hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai. Today, I would like to show you all an interesting case scenario to whom I came across very recently in a man who just completed 40 years of age who presented to us with pancreatitis. What do you mean by pancreatitis? Once the patient is going to land up with any evidence of inflammatory activity in and around your pancreas, the patient may develop multiple complications. Sometimes the patient may have persistent vomiting, sometimes the patient may have persistent abdominal pain, sometimes the patient may have an intensive care treatment in which the patient may develop multi-organ dysfunction syndrome. So once the patient is going to land up with this kind of complications, the patient need to be in regular follow-up with the gastroenterologist for long-standing duration, and this patient been developed a cystic collection in and around the pancreas, what we call as pseudocyst of pancreas. Since the patient been alcoholic for long-standing duration, used to take alcohol for years together as a binge without any evidence of abstinence as of now, and followed by the patient being developed with this kind of presentation. So what we have decided to do a endoscopic therapy, and followed by we have placed a stent to this patient through ERCP procedure, and we are going to remove the fluid contents from the pancreatic pseudocyst lesion. And why I would like to point out this picture, if the patient is going to land up with this kind of presentation, they may have multiple complications. The patient may have persistent abdominal pain, the patient may have weight loss. If you're going to see so much of fluid being removed out from the cystic lesion, and once you're going to remove this kind of presentation, the patient's symptoms will improve very well. Thanking you all for patient listening.